Hello everyone, a very warm welcome to all of you in this video. Today I will discuss about the subject called hematology. We all know that hematology is the study of blood. But in this video, I will precisely summarize the entire hematology subject. So I request you, all of you, to please watch the full video. And if you like the video, please share with your friends. So first of all, we all know that hematology is the study of blood. But if we go for a specific definitions of hematology, it's emphasized the two words. One is called production, another is called disease. So hematology is the study of disease and development of blood cell. So why it is called the disease and development? What basically we means about development? Development means step-by-step process to produce a mature cell. From the precursor, from the very first cell to produce a mature cell, this entire process is basically known as the development of cell. And disease means the various kinds of abnormal conditions that are associated with that particular blood cell. So in hematology basically, there are three different type or three different area we basically need to study. The first area is the productions of the blood cells and their specific morphological features. For an example, we all know that this is a terminology called hematopoiesis, the physiological process of the formation of blood cell. So in the first portion of hematology, we basically study the types of blood cells, their precursor cell, how they produce, what are the factors involved in the productions of this type of cell, and what are the morphological features. If we don't know how the basically cells look like, how do we diagnose? We all know that RBC are anucleated cell. In case of WBC, there are 5 different types. In case of platelet, they appear as a dot-like structure. But in case of abnormality, in case of any hematological malignancy, the precursor cell are present in the peripheral blood. So we need to understand the different types of precursor cell, how they look like, to basically produce a specific report which emphasizes the types of hematological malignancy or abnormality and the lineage of the cells are basically involved. So in the first portions of hematology, we basically study the each and every cells, their precursor cells and their morphological features and how they look like in the peripheral blood smear, or rather I say how they look like in Romanowski group of stain, right? In the second portion, we study basically the abnormality related to the each and every types of blood cell. So what are the abnormalities that are basically involved? We all know that blood is a liquid connective tissue, and in blood there are two different portions. 55% is called plasma and 45% is called cellular component. We all know that. But in cellular component, each and every specific cell have a specific related disorder. For an example, in case of RBC, the major disease that are involved in RBC related like anemia. We all know that anemia basically decreased level of our hemoglobin less than 10 gram per deciliter or 7 to 10 or below 7, and WHO classified based on that level of hemoglobin like severe, moderate, mild, etc. We need to study the anemia, the cause of anemia, different types of anemia, and how do we basically diagnose the anemia, what are the special tests that involve in the diagnosis of anemia. Each and every aspect for the detections of anemia we need to study. The second most important disorder that are related to RBC is thalassemia. We all know that thalassemia is an autosomal recessive disorder, and before marriage we all need to check our hemoglobinopathy, or we can call it HPLC or hemoglobin electrophoresis, to detect any abnormal hemoglobin related disorder, and among them thalassemia is the major one. So thalassemia is the types of, in case of thalassemia basically anemia occurs, but what is thalassemia, what are the types of thalassemia, what is alpha thalassemia, what is beta thalassemia, what is beta thalassemia, in case of beta thalassemia what is minor, what is major, what is intermediate. So we need to study that specific thalassemia related zone and specific test to detect the thalassemia, to detect the carrier and further process. So a third disease that are involved and related to RBC is polycythemia. Polycythemia is a disease, is a condition in which the hemoglobin or RBC basically increased their level, PCV level, RBC level and hemoglobin level increase in our blood basically. We all know that there is a specific count of the RBC like 4.5 to 6.2 million per cubic millimeter in a male, and PCV is around 40 to 50%, hemoglobin is around 15 to 17 gram per DL. If this criteria, if this level are increased due to any reason, this condition is known as polycythemia. The viscosity of the blood is basically increased and there is a chance of cardiac arrest and other consequences also. So in second portion of hematology, first is RBC related disorder, and the three major disorder we need to study, that is anemia, thalassemia and polycythemia. Now the second one is WBC. We all know that WBC is the specific and special cell in our body that fight against any foreign particle. They produce specific immunity to us. They produce the antibody, the T cell and natural killer cell directly kill the foreign particle. So they act as a police. They act as an CBI in our body basically. So RBC is a specific part of the blood which basically delivers the oxygen to the tissue, and WBC basically provide us, our body provide our each and every cell to fight against the pathogen. So WBC related disorder, in case of WBC related, there are many disorder like leukocytosis, leukocytopenia. Each and every linkage or lineage of the cells can affect it. Like in case of neutrophil, there is some condition where neutrophil count will be increased. There is some condition neutrophil count will be low. If neutrophil count is increased, basically we call this neutrophilia. If low, neutropenia. Many diseases basically associated with WBC, but we need to study the one disease, and that is the fatal, that is the high mortality rate, is called the leukemia or blood cancer. So what is leukemia? What are the types of leukemia? Like in case of hematopoiesis, there are two lineage like myeloid series or lymphoid series. So leukemia basically two types, myeloid leukemia or lymphoid leukemia. But in myeloid leukemia or in lymphoid leukemia, there is many different types, different specific types of cell get affected, and different types of leukemia will be basically follows. So we need to study each and every types of leukemia. Classifications of leukemia like WHO classification, French, American, British classification, all of them. If we provide the targeted therapy, we all know that the basic and main therapy is the bone marrow transplantation. But leukemia is a condition which is basically occurred due to mutations of gene. Like in case of CML, there is a situation where the translocation of the chromosome will be occurred. That is called the Philadelphia chromosome. Like common test is MPO stain, myeloperoxidase, which is an enzyme basically present in the cytoplasm of the myeloid series cell, which is absent in the lymphoid. So basically we need to study the cytochemistry like cytogenetics, immunophenotyping, each and every aspect to detect the specific cause of the leukemia and to provide the targeted therapy. And the third is platelet, and the platelet related disorder we need to study like thrombocytosis if the platelet count is increased, or thrombocytopenia if the platelet count will be low. So this is the second portions of hematology. The first portion is how the blood cells are produced, how their precursor cells look like, how the mature cells look like, normal range of the each and every cells, what situations will be happen if this type of cell will be increased or decreased. So this is the first portion of the hematology. And the second portion is disease associated with the each and every specific types of cell. Like in case of RBC, anemia, thalassemia or polycythemia. In case of WBC, the main is leukemia. In case of platelet, thrombocytosis and thrombocytopenia. We need to study the different situations, different sign, different symptom and lab diagnosis of the particular hemoglobinopathies, leukemia, platelet related disorder to provide the specific and targeted therapy to the patients. So there is lots of lab tests will be required. There is lots of sample will be required. There is a specific bone marrow related sample will be required. Cytogenetical study will be required. Cytochemistry will be required to produce a specific targeted therapy and to basically detect the specific cause of the particular types of disease. So we need to study that. And the third portions of hematology basically is the coagulation study. Suppose we have a cut in our tissue, bleeding will be occurs. So how the bleedings will stop? What are the types or what are the mechanism involved in the stopping the bleeding? This is known as the coagulation. If there is something cut in our skin or any part of the body, bleeding will occurs. At first the platelets are get activated. They are basically present to the particular cut area. They are aggregate. They try to produce a specific primary hemostatic plug to stop the bleeding, and this portion is known as basically primary hemostasis. In case of any injury, the platelet first come, they are aggregate, they try to stop the bleeding. This is known as the primary hemostasis, and the platelets are basically, they are non-capable to stop the bleeding permanently, so they need to basically activate our clotting system, our coagulation system. There is mainly 13 clotting factor present in our blood, so platelet get activated, they activate the clotting factors are come together and they produce a permanent clot. This is known as the secondary hemostasis. So in case of coagulation related study, we need to study the basically what are the factors related deficiency, coagulation related deficiency like hemophilia. So this are the third portion of the hematology, that is the coagulation portion, and different kinds of tests will be basically present in particular portion, like prothrombin time, activated partial thromboplastin time, clotting time, bleeding time, and D-dimer test also basically perform D-dimer test massively in case of COVID related case, like. So these are the third portions in hematology. So these are the basically the specific summary of the entire hematology. Like hematology is the study of disease and development of blood cells. These are the specific definition. We need to study each and every process of the formation of mature blood cell, and each and every cell have a specific disorder. We need to study that. So that's why we call it is the study of disease and development of blood cell. In hematology, basically three different portions. The first portion, we need to study the each and every mature cell, their productions like hematopoiesis. The mature cell have specific features, we need to study them, and each and every mature cell are produced from their precursor cell, or we say the blast cell. Like in case of WBC, the first cell will be myeloblast, then promyelocyte, myelocyte, metamyelocyte, band from, then neutrophil, eosinophil or basophil. So how do you differentiate between the band form, neutrophil, eosinophil, basophil? You need to study before, because we basically know that when mind doesn't know, eyes can't see. We need to study each and every precursor cell, their morphology, their nuclear character, their cytoplasmic character, to basically detect and find out the specific precursor cells and their mature cell and their lineage. So the first portion, we need to study the cells, their characteristics, their precursor cells, their each and every cells have the specific characteristics. We all know very much well to detect a disease. The second portion of hematology is basically disease that are related to the each and every cell. Blood basically have three different types of cell: RBC, WBC and platelet. So in case of RBC, anemia, polycythemia and thalassemia we need to study. There are many other diseases also associated, but these three diseases are most common, and we need to study each and every disease very clearly to find out the exact cause, that the patients suffer from, and to detect it and to provide the therapy to the patients. Then the second cell is WBC, and the main disease that are associated to WBC is the blood cancer or leukemia. We need to study the types of leukemia, the classifications of leukemia, the special lab investigation like cytochemistry, like cytogenetics, like immunophenotyping, to produce a targeted therapy to that particular patients. And the third one is platelet related disorder like thrombocytosis and thrombocytopenia. So these are the second portion of the hematology, and the third portion is completely different from these two portions, right? The third portion is known as the coagulation. In case of any bleeding, in case of any injury, how the blood basically stop from the bleeding. What is coagulation? What are the function? What are the role of platelet? What are the role of clotting factor? What will be happen if one or two clotting factors are deficient in our body? So we need to study the primary hemostasis, we need to study the secondary hemostasis, we need to study the clotting factor, their production, their basically specific features, their specifications, and the related abnormality like hemophilia, like Christmas factor deficiency, like fibrinogen deficiency. So we need to study each and every aspect very clearly.